All right, well, this is the second part of chapter two, and I did split the chapter because, um, there's quite a bit of information on stress that we need to cover that I think is really important that you're aware of as an EMS provider because you're going to find yourself in some really stressful situations. And so knowing a little bit about that, I believe would be helpful. Um, so the physiologic aspects of stress. Uh, Stress is inevitable in our profession. You are going to see um, some horrific things in your career, and when you do, it will take a toll on your psyche. Uh, and it's important that as an EMS provider that you recognize the signs of stress and that you develop strategies as an EMS provider to deal with stress when it does affect you. Now, as a general rule, we need stress. If we didn't have stress in our life, we wouldn't get out of bed. We would have no motivation whatsoever. The stress of paying our bills, the stress of um, doing a good job at work. Those are things that are necessary and motivate us to be productive. Um, but when we get too much stress, it has a negative effect on our body that leads to disease and even death. Um, as far as the stages of a stress reaction, an acute stress reaction, um, initially when we're exposed to stress, the first stage is called the alarm reaction or the fight or flight stage. In this particular stage of the stress response, our body releases chemicals, and I like to think of them as harmful chemicals. Um, when we are startled, when we feel threatened, uh, that's stress. And we release adrenaline, which makes our heart beat faster and stronger, which if it's a continual release of adrenaline time after time after time, it can lead to things like hypertension, diabetes, stroke, all kinds of things are associated with chronic stress exposure to stressors. Um, so you also release chemicals like aldosterone, and you release renin, and you release all these different hormones that are really harmful on the body. They raise your blood glucose, and constant high blood glucose leads to diabetes. Stress can be very detrimental to the body. The second stage of stress is when your body attempts to cope with the stress. If you don't have good coping mechanisms, good ways to deal with the stress and to alleviate the stress, then your body will develop ways to cope with it itself. You may lose your appetite. You may not need to sleep as much or sleep more. So your body sets up this stage of resistance and tries to cope with the stress. But if you don't cope effectively with it, the third stage is exhaustion. And exhaustion occurs when your body loses the ability to resist or adapt to the thing that's causing you stress, and we call that a stressor. And the thing about this first, second, and third stage is that it's not the same for everybody. We all respond differently. We all find different things stressful. So it's not the same for everybody, but do understand that initially there's a release of these harmful chemicals in your body that if you don't control or cope with the stress, over time these chemicals break the body down, lead to disease and even death. And that's the third stage, or the exhausted stage. Any situation that triggers a really strong emotional response, like the death of a coworker, the death of a child, seeing really something horrific at a motor vehicle collision, like a decapitation, Um, when you see those things, they can cause what we call a critical incident. And a critical incident um, leads to the need for critical incident stress debriefing. We run into things that people run away from. We see things that no one should ever see. But that's the nature of doing the business that we do. Um, and because of that, if we don't handle this stress properly, it can lead to, again, disease and death. Acute stress reaction is often linked to a catastrophe. In other words, you are part of something catastrophic that's happening in your environment. It not only occurs in your patients who are involved in this, major motor vehicle collision with multiple victims, or this explosion at a school with multiple victims. It's not only your patients that are being stressed and their families that are being stressed, but you as an EMT as well. Signs and symptoms will start to develop within hours following the incident. The signs and symptoms will be physical. You can be sick to your stomach, diarrhea, headaches, cognitive. You're not able to think or concentrate. Emotional. You may have outbursts of crying. And then behavioral symptoms, where you increase your use of alcohol or rely on drugs to numb you to these certain things that you've just experienced. Understand that when you have an acute stress reaction, that is a normal reaction to an abnormal event. So when you see something horrific and you can't sleep at night and you burst out in tears for no reason and you can't eat and you're irritable, you're not going crazy. That is a normal reaction to an abnormal or an extraordinary situation that you've been thrown into. Now, it may require professional intervention, and that's what we call critical incident stress debriefing. PTSD was first defined in our soldiers returning from Vietnam. Dr. Jeffrey Mitchell and his crew coined the phrase post-traumatic stress disorder, and we often relate it to, it probably occurred in World War I with soldiers coming back who were shell-shocked, recorded in World War II and in the Korean and Vietnam War as well. But it really was the Vietnam conflict where soldiers returning home were experiencing this. In modern day warfare, certainly our soldiers returning home from the Middle East have been diagnosed with PTSD as well. And they're finding, however, that some of that is directly related to concussive injury from a blast rather than post-traumatic stress, because the symptoms of both are very similar. The longer you wait to take care of this stress reaction, the harder it's going to be to deal with it. And we have what's called a critical stress debriefing team. There are 3 counties that are involved in the team, multiple people from all types of EMS jobs, paid and volunteer, rural and urban, fire, law enforcement, EMS, nurses, doctors, who all participate in providing this critical incident stress debriefing to those people in need. Cumulative stress reaction occurs from years of sustained low-level stressors. It's called burnout. A person just has vague anxiety. They get anxious. They really can't put their finger on why, or they're emotionally exhausted. They just can't do this anymore. And this is, by this point in time, they're probably already exhibiting signs of other diseases related to stress, whether it be coronary artery disease, hypertension, diabetes, even cancer can be related to this as well. Cumulative stress progresses, as I mentioned, into physical complaints, loss of emotional control, irritability, depression, suicide, severe withdrawal, and may require long-term psychological intervention in order to treat it. So look what you have to look forward to. It takes a very special person to be an EMS provider, to be a law enforcement officer, to be a firefighter, because of what it is that we see and do. And it's important to know that you'll experience these things, but that you're not going crazy and that there is help available. Some causes of stress in EMS include multiple casualty incidents, any call involving infants or children. The first time you respond to a motor vehicle collision with 3 dead children and a grieving mother, that's a wrencher. That's something you're never going to forget. Severe injuries, gross injuries, decapitations, disembowelments, people cut in half, crushed, those sort of things. You'll burn beyond recognition, on and on and on. I mean, you'll see severe injuries in EMS. Abuse and neglect, particularly of children who are beaten and abused or neglected. The death of a coworker is a critical stressor as well. I'd mentioned that stress is important in our life, and that's called eustress. Eustress is a positive form. It helps us work under pressure and respond effectively. Distress is when we get too much. It's a negative stress causing immediate and long-term problems with our health and our well-being. Some signs and symptoms that a person is under stress: they may become irritable. They may not be able to concentrate. They may make changes in their daily routine. They may be extremely anxious. They may be indecisive, again, not able to concentrate, not able to make decisions. They may experience survivor guilt. They may want to retract and be isolated. They may lose their interest in work. Some of the things that we can do to deal with the stress that we see in EMS, most importantly, is to develop more healthful and positive dietary habits. By exercising, eating properly, getting enough sleep, devoting time to doing things that we enjoy, maybe changing our shift or our location for a lighter call volume, go to a different area where call types are different, and spend more time away from EMS with family and friends. Critical stress management it's a comprehensive system. It's actually a 7-step process that we work people through. It includes, recognizing that you are in fact under stress, identifying the signs and symptoms, providing education and resources to help you deal or cope with the current stress that you're feeling, as well as to help you work through stresses in the future. And that's all part of CISD. We can do a diffusing immediately after an incident, which is not a 7-step process, but then we can do a debriefing later. And again, we are a team of trained peer counselors, mental health professionals that will meet with healthcare providers following an event, typically within a day or two. You get much further out than that, and this process isn't near as helpful and actually may be harmful. The whole purpose of CISD is to help the responders deal with stress. Typically we don't see dead people unless we're at a funeral. But as an EMS provider, we're going to see dead people. And that's often can be the most difficult part of your job, especially if family members are present and you have to console them or inform them that their loved one is dead. People will go through the emotional stages of dying. Not only will patients go through these, but you as a provider can go through these as well. Patients' family members can respond this way as well when they are in crisis. The emotional stages of dealing with death and dying, one is denial, or hey, I'm not sick, I'm not the one with the problem, I'm okay. Anger deals with why me, um, bargaining. Okay, I know that I'm going to die, but first let me do this, and then I'll be ready. They may become depressed, and at the end, one of the final stages of death and dying is acceptance. Um, Accepting the fact that you're going to die and you're no longer afraid. Not everybody goes through all 5 stages. Not everybody goes through the stages in this order. So just do understand that if you're a scene and a patient's family member is screaming obscenities at you and telling you to hurry up and pushing you, and you have got law enforcement there, they certainly can restrain the family member from getting in the way, but that's not personal, and don't take it personal. It's just their way of dealing with the stressful situation. We need to be able to recognize what our patients' needs are, the surviving people. Again, be tolerant of angry reactions from patient and family members. It's not personal. We need to listen empathetically. Empathy is something that is learned and something that we should practice when dealing with all patients who are sick and injured, not just those that are dying, but um, patients don't want sympathy. Um, they don't want you to feel sorry for them. That's not what they're looking for. But oftentimes they just want to be heard. They want you to listen. Um, you would respond by not falsely reassuring them and telling them that everything is okay. You would respond with things like, I am so sorry. You must feel horrible. I have no idea. One of the worst things you can tell a patient is, oh, I know exactly how you feel. Because you don't. You don't know exactly how they feel. You may have been through a similar situation, and again, we all respond differently to different stressors. So listening empathetically is acknowledging their feelings, um, and going from there. EMS is not usually a dangerous profession, but you can find yourself in some pretty dangerous conditions. Whether you're dealing with confined spaces where there are deadly gases, busy highways where you're working a motor vehicle collision, high-angle rescue, all these sort of scenes with animals, certainly can be dangerous. So it's important that you determine scene safety on each and every call. Hazmat incidents, we'll have a section in the program where we will provide training and education at least at the awareness level, if not at the operations level. So when dealing with hazardous materials, which could be corrosives, pesticides, deadly chemicals like anhydrous ammonia, chlorine, those sort of things. The primary rule with dealing with hazardous materials is to maintain a safe distance. We like to use a rule of thumb. If your thumb can occlude the scene, then you're far enough away, and you should get your binoculars out, identify what that hazard is, and notify the appropriate people that are trained to deal with it. Placards are something that you'll see on a vehicle. It's a 4-digit number that you can look at, and using your emergency response guidebook in the blue pages, if you know the name of the chemical, you can look that up, and you'll give a 3-digit guide number, which will take you to the orange pages where you'll find the safety data sheet for that chemical. If you know the placard number, you can look that up in the yellow pages, and it will give you a 3-digit number in the orange pages, again, that will take you to the safety data sheet for that chemical. Your role is to recognize that you're dealing with a potential hazardous scene, and then to take actions for your safety and then the safety of others, and then notifying trained people who deal with hazardous material response. Our hazmat team in this area, which I'm up in Spirit Lake, Iowa, is out of Sioux City. And it's going to take them a while to get here, so most our fire departments and responding ambulance services are trained at the operations level and can participate and do decontamination. So we don't want to treat patients until after they have undergone decon. However, we may have those patients who may require some treatment prior to being decon, like administering oxygen, a auto injector, something like that. Terrorist incidents, they can be very small scale or large scale. They don't have to involve a person from a foreign country. Prior to 9/11, the largest terrorist event done by an American was done on American soil, and that was Oklahoma City. The bombing in Oklahoma City of the Arthur P. Murrah building using chemicals, ammonium nitrate fertilizer, and an ignition source. So we talk about CBRNE, chemical, biological, radiological, nuclear, and explosive devices as things that terrorists will use in order to instill their fear and get you to believe in their way of thinking. Rescue operations is something else that you'll may or may not do depending on your role as an EMT. If you're a firefighter EMT on a fire rescue, then of course you may be actively involved in disentangling victims from motor vehicle collisions using rescue tools and equipment. You may be dealing with explosions, electrocutions, and other things. So it's important that as a responder that you evaluate each situation to ensure that you've got the right help needed. And don't do something that you're not properly trained to do, because you could become a victim. And dead heroes don't save lives. Violence, you're going to be dealing with situations where violence has occurred or law enforcement is at scene. So here, thinking specifically about something like domestic violence, it's important that when you go into a scene that you have a portable radio whenever possible. The portable radio can, of course, be used to communicate a need for additional resources, but can also serve as a weapon if you need it to. Get your equipment prepared so that it's not cumbersome, and you can either drop it and leave quickly, or you can leave with it quickly if you have to. Wear safe clothing depending upon the scene that you're dealing with, and decide what your roles are in approaching a scene where violence has occurred. Do a scene survey. Make sure that law enforcement is on scene. It says don't announce your arrival. In other words, turn off your lights and sirens prior to getting there. Drive a few feet past the residence so you can see the front and the sides before approaching the residence. And here we're talking again more about domestic violence. You're going to be responding to crime scenes. And you'll need to know how to approach a crime scene, and we'll talk about that in detail later, but you're going to need to know how to approach a crime scene to preserve criminal evidence. Most, or if not, a good share of domestic violence crime scenes involve some sort of alcohol or drug use or abuse as well. There may be weapons present, so knowing that is important, and that's why we have law enforcement present. And have made sure the scene is safe before we enter. There'll be family members present that can become violent, bystanders. The perpetrator could still be on scene. And don't forget pets, particularly dogs that could bite if they believe that you're harming their master. How you should react to danger as an EMS provider. Remember the 3 R's. Retreat. Don't ever box yourself in where you can't get out quickly. Radio for help, and then don't re-enter the scene until it's been secured by police. I would say don't enter the scene until it's been secured by police. You should never put yourself in a situation where law enforcement isn't there first. Wait for law enforcement, especially if you know you're entering a scene where violence has occurred. Worst case scenario, drive away. If you have to leave equipment behind, you leave equipment behind. Take cover and conceal yourself if you can't get away in the vehicle, especially if weapons are involved. Okay, so that ends our discussion on part 2 concerning stress and violence and other things that as an EMT you'll be exposed to. So I'm going to move on to chapter 3, and if you got any questions, your site coordinator will know how to get a hold of me. Talk to you soon.